Good afternoon, everyone. Thank you for that introduction, Cohen. It's a pleasure being the moderator of this session that we're having today. So it's an interesting session that we're going to have, which is on health information systems and digital health. And we're going to be looking at two main items under this area, and that is the role of young people in health communication for social behavior change, and also leveraging the potential of digital health solutions to improve access to healthcare services. So in this plenary, we'll be having three speakers, and our first speaker is Mr. James Kamande, who's program manager at PS Kenya and works in the division of human generation and social behavior change. Welcome, Mr. James. So our second speaker is Dr. Mandela Kibiriti, who is a Diagnostic Performance Manager at Behaviour. I guess most of you have been seeing Behaviour in most of the billboards somewhere as of now. Welcome, Dr. Mandela. And finally, we have John Mwangi, who's the founder and CEO of Daktari Online. So I don't know if John is here with us today. So maybe I'll just briefly read to you their bios. So we have Dr. Mandela Kibiriti, who is passionate about realizing health for all in Africa through technology and innovation. And we believe this is best achieved through collaboration among key players in the health sector, and also in pursuit of this vision, he seeks to push innovative concepts into practical solutions in the health space. For James Kamande, he has 13 years experience in health system strengthening, social marketing, and behavior change communication. So I'm hoping that all of you are going to explain at least. I think these are complex titles we have, so I'm hoping that you're all going to explain at least what is demand generation and social behavior change, and also the Mandela's role on diagnostics. So finally, we have John Mwangi, who is a computer scientist and co-founder and CEO of Daktari Media Africa. I believe for maybe here, we all know Daktari Online. That's where you get your CPDs. He's an independent multi-speciality, multi-cadre healthcare content development and dissemination company. That's the company name. After realizing a significant knowledge gap between doctors working in cities and those in remote areas of Kenya, he built Daktari Online. So this online platform currently supports over 18,000 Kenyan healthcare providers learning goals for appraisal and re-licensure by delivering relevant content created by experts in easy-to-access formats and helping healthcare providers to gather evidence of their learning. Daktari Online is the leading online continuous medical professional development provider accredited by KMPDC. I believe you know KMPDC, which is the Kenya Medical Practitioners Dentist Council, Nursing Council of Kenya, Clinical Officers Council, and the Pharmacy and Poisons Board to provide continuing medical education for general practitioners, clinical officers, and other primary professionals in Kenya. They recently also got accredited by Uganda Medical Practitioners and Dentist Council. I didn't know about that. Congratulations. And also, before been awarded the Young Innovators for Health Award. John's innovation was one of the 5 startups in Kenya that won the 2020 Next Innovation in Japan, Ninja, in brackets, business plan competition in response to COVID-19, organized by Japan International Cooperation Agency, GCAP. So welcome, gentlemen, to this panel. All right, so I'll just start by giving a brief fact check, and that is on medical errors. And I don't know if you all know that medical errors in the United States causes at least one death every day, and it injures approximately 1.3 million people annually. And the other thing is globally, the cost of medical errors has been has been 42 billion annually, $42 billion annually, and 1% of total global health expenditure. The reason I'm bringing this up is because technology in health has been seen a lot to reduce the medical errors that are existing in our hospitals. And in this session, we're looking at health information systems. And the definition of health information system is a system that is designed to manage healthcare data. And then for digital health, it's a platform, it's a computing platform or software that is used. For example, in this case, we can give an example of Behaviour, which is a medical app that is used. So, just jumping into the questions for our panel today, and we're going to start with John. We know that health information is a critical drive with health data ranging from social behavior, change communication, and health advocacy. And youth are primarily focused in the social behavior change and health advocacy, mainly through social media and other platforms. So, how can we mainstream these international priorities in advancing UHC in Kenya?
Thank you, Luke. Thank you, everyone, for having and organizing this. It's quite informative. Let me say also that the struggle meeting and lastly what I heard and what I'm hearing again. It's quite it is a shift that's happening in the healthcare system. Let me start by maybe defining what you can see. All of us maybe have seen this definition WHO saying it's about access to quality care without having to make people poor because of the finance they have to use that. I'm just paraphrasing. And looking at the data in Kenya, over 60% of the population are young. And the conversation we had in the morning about health financing, if these people are not incorporated, then you're secluding 60% of young people. And if the meetings that we have to have with these policy makers, youths are not part of that, nationalizing this agenda will not happen. This advocacy for youth has to have youths be part of the proposition. Someone earlier said, if they don't give you a seat, I'm with a foldable seat, sit there. Thank you.
Thank you so much. John, maybe you could move to Mandela.
Thank you as well for organizing this exciting event. And I'm happy to see young people. Usually in such events you see old people on the front, but now this is a young conversation. This is really amazing to have. I do agree with John about bringing your side to the table. I think just echoing what if anyone knows ALX and ALE, Fred Swanica, the founder, used to say the privilege of being in the African continent is that one, by 2025 we'll have the largest workforce in the world. That's one. Two, with that workforce, it's very important to think about it in the sense of you now have the opportunity to literally do whatever it is that you want in this time and space to make a global impact on whatever you do. So taking that seat, putting it on that table is us as young people. It's a responsibility, actually. It's a call to us to make sure that we can actually do those things. And yes, there's certain things that are happening in the current space right now, in technology. Right now, ALX has now started 11 cohorts of training in technology in different cadres, from medicine to logistics, wherever you are. So you can build capacity as an individual to take that step, take that seat onto that table. Even what my good friend Dr. Bethel had mentioned, there are certain areas in health that do not require you to sit in a hospital, in a lab coat to actually provide value to the patient. These are things that we as young people should really focus on, thinking outside the box, looking at what can be done within our own capacity to actually be there, stand proud, and actually make changes in our society. And if you're man enough like me, who was in undergrad, to talk myself so programming and still did medicine, do it. If you want to start your own business while in school, do it. Whatever it is, just start. The rest, it's all it's about.
Okay.
with respect to it, right? So I'll say that somebody stood here and said that, or give you the feedback. This year in August, one of the things that influenced the current regime was youth and social media. And then you realize that many of the things, including UNC and policies, they are influenced by politicians. And politicians do what the people who elect them think is popular. So until you who are putting politicians there are able to sit down and kind of decide what is this that we want, and therefore, because we have numbers, and you have numbers, you can always even some you are government. Instead of building hospitals and dispensaries, we want ABC, and we will listen, including UNC. Further to that, we are on social media, or we are in social media, we are sharing about ideas, insights. I just wish if we had some tools on social media that can be doing social listening and can be collecting all the ideas. Somebody will be able to synthesize a panel those ideas and be able to synthesize them into objectives. And those objectives can be converted into policies, and then the youth can be use those objectives and policies to engage their politicians. Because until you are able to engage the politicians, you can't do much.
All right, thank you so much for your contributions. And I think what stands out most is that with the youth, there's a lot of power in us, especially the fact that most of us are tech savvy, and we can leverage that to influence we can leverage that to influence whatever we have in the health sector that we need to assist in. So there's what I'd like to ask next now is in your areas of practice, do you have the youth in place in that area, and what exactly are they doing so that at least for the people, so that people can see that the youth are really working out something in your areas of work? So maybe we could start with James.
Thank you so much. So I work with PS Kenya, and so the logo there. So in PS Kenya, we actually, around 3 years or 4 years ago, we pushed for a policy. We have it in terms annually, and 20% of those incomes has been absorbed. And a good example of that is that team there, we have around 2 who came in as interns and now they are staff. And because we have youth programs, we usually give them a chance to learn the youth program, because they are the people who understand the language of youth, what people want, how they want it, where they want it. And I can tell you in some of the programs, like programs that are focusing on adolescent sexual reproductive health and HIV testing, it's rolling out better, because if you go to the social media and you check, the messaging there has been designed in the lingo of youth, by the youth.
Okay, for us, so Bank is a telemedicine company, and we are really focused on providing care to patients. All the doctors who work with us are actually under designate. That means the specialists, the general practitioners, and We have close to 60 of them that we're working with. And beyond that, beyond just providing the digital aspect of care, we're also trying to empower young practitioners to start their own clinics or some form of a clinic.
Basically where we are trying to ensure that these doctors can then start their own clinics, work with patients, create a financing model for them so that when they do start these clinics, they don't start from scratch, wondering how do I serve my patients, what do I price my drugs and my services at, how can we make this sustainable for them. And by creating this hybrid solution by providing a digital component, which is our application, together with the physical aspect, which is the clinics and the centers that they work with, we are trying to bridge that gap of patient care here. We get around 20,000 monthly users of our application, so this is a way of now capturing patients for these doctors to actually get them working. And because we're digitizing the entire process, we're able now to understand what are the outcomes for each and every single care. So, case in point, if there is lack of capacity, we can easily train these doctors to better handle their patients from wherever they are, or to utilize the resources that they have, so that the care they give these patients is actually quality. Because at the end of the day, a healthier patient is a very good patient to have because you don't have as many expenses, but there's also loyalty. The patient will stay with you throughout the entirety of the care, and it may not just be for them, it could be the people that they love, their friends, etc. So we're trying to create this space for doctors, especially starting out, to now have a way that they can take ownership.
So I hope you had all of that. So how they can take ownership of their practices and start and grow those practices, and it's optimized digitally through the platform that we've developed.
Thank you so much.
Maybe just a quick one. Maybe building on that. We are more content creation company. We create content for learning. And one of the challenges we faced when we began was trying to get content from all consultants and professors. Glad Lad is here, but we don't. So they would have appointment with them to do content, and would end up there in the evening, and they tell us to come tomorrow. And we chase them a whole week until at some point we had to give up. And we realized, wait a minute. Yes, they may be known as the key opinion leaders in that baby training, but they are younger consultants that are trained. And let me tell you, the day we discovered that, that was our aha moment. Now we've been giving opportunities to younger consultants, whether pharmacists, nurses, and doctors, and that even the older ones, now they attend the lectures of the younger ones. So yes, we do that. Those who have internship programs within the Daktari line.
Thank you so much for those contributions. I think with that you can see that young people are really trying to have technology adopted, and also the elderly, they are slowly taking it in, which is a good thing for all of us. So maybe in your opinion, let you hear opportunities that are there for young people to get into, let everything that happen with their technological experience.
Thank you. The areas are many, but one thing you have to note, they are not obvious. If you are keen in the sessions that were here, all the challenges that were enumerated here, those are opportunities. Because every opportunity presents as a problem. From logistics, whether the supply of medicine, to healthcare monitoring using devices, be it AI, incorporation of AI. Actually, there's an interesting one that we're working on, and we're still looking at that. Being in the online platform, there's a technology called reverse billing, where anyone who accesses the site, they are not billed data. Data is built on the people. It's built on a company or built on someone else. So that those users, especially in the rural areas, who do not have access to connectivity or good connectivity. You can access the content for free, and data is reversed, billed to others. It's working in South Africa, here we still have some changes, but there are many other areas that we can look at. But any problem we hear in the health sector is an opportunity. In fact, let me just finish with this. I heard that out of a hospital bill, almost 40% is medicine and devices cost. And on Monday, we had the CEO of cancer who was enumerating what goes on in cancer. And part of the bill they pass on the medicine is because of logistics. If someone was to innovate around how they could monitor and track and make it easier logistically, that bill from cancer would translate in a patient's bill. These are some of the areas. Why would NHI or why would private insurance bill you more for your premiums? Because eventually the hospital bill is big and they are the ones who pay it. So if you can look at what our problem is, see how you can innovate around that. You can influence the entire system of the health.
Thank you for that, John. I'm hoping for the youth here to listening keenly on some of the ideas that can be innovated on. Go ahead.
Yeah, so I think just taking what my colleagues are saying. So if you look at how industries have been built over a couple of decades ago, from 1700s up to now, we moved from mechanization to automation to digitization to now personalization. Now we're in this sector between digitalization and personalization. And it's really critical that as young people, it's good to ask, what do we need to do, but it's also good to ask why and who. So for us, for example, we're very keen on understanding who are we trying to target and why are we doing this beginning. And when you ask those kinds of questions on a regular one, you start seeing certain things that you can do, from the get-go, to bring access to care, to ensure logistics is met, to ensure that the cost of care comes down, to building capacity, all these things. Because at the end of the day, what is technology? It's a tool. But who enables it? It's the people. So if you focus on the people that are actually, suffering from certain challenges within the sector, if you look at what kinds of issues that they're facing, you will see many of the problems, but also a lot of opportunities. And because we're in the African setting, so we were invited to a business leadership Norway forum that was there last week. One of the things that came to mind is everyone in the room from these countries came to Kenya for two reasons. Young people, opportunities. If they are coming from where systems work to here, that tells you something. That there is a role that we need to play as young people to solve the challenges that we're facing. And it's within our fingertips. So going into this and echoing to what one of us said, which is be brave. Yes, be brave. Out there is a lot of things that can be solved, and you are actually the person who can solve it.
Okay. Okay. So I'll start out there. And the first obvious opportunity is the platform creation. We have apps, we have health apps all over, and TIBA and others. A few have been designed in Kenya, majority are from outside. And of course, they take advantage of the digital health unregulated market in Kenya, which is something that we must, or the government, needs to take action very fast, and these are come up with regulatory measures or legal mechanisms to regulate. So youth, there is an opportunity there for the IT guys in health to develop our apps. Secondly, content creation. You're very good, you have ideas. Companies out there are looking for guys who are very creative with content. You can start just like any other person, and there is a lot of opportunity. The other thing is service delivery. In January this year, under a DBB program that we are running, we kind of online, we have a phone number online where people can call for counseling services. And there's a man that was over 100,000 requests for counseling, just counseling. And you are imagining if somebody had an app and was able to link counselors to offer services, it's a very small thing. And many more other opportunities out there.
Can I do a shameless plug over here?
Alright, thank you so much for those contributions. So, I was just looking at if you were to come up with an idea right now, like prospectively, what areas are you looking at the technological future? Like where are we heading at the moment from your own view? Maybe anyone can start.
Those interviews. I think one of the big things right now is data, right? Data and all the data technologies around it. Think blockchain, right? In terms of data privacy. Right now there's a lot, everyone is afraid. Any data aggregator is afraid of the new laws. I've had some conversation with some international people wanting to set up some apps in Kenya, but they're afraid of what the data protection rule will do. That in a way protects us, right? Right now, you can't come from outside and take in data and go with it. If you are caught, that is a legal battle there. So data is one place to invest. I heard you mention about data in medicine, tracking how the logistics and all that data. And you mentioned about making care personal. And there was this interesting conversation around if we knew what your body reacts to, and we have that profile, and make it portable, so that every time you present before a care provider, you don't have to keep asking you for your history. You just avail it to them. Imagine what that does. There's something called One Health Visa. I don't know whether you heard about that. So that's when some of our loved ones travel to India for further treatment. You don't have to carry all the paperwork, all the tests from Kenyatta and every other place. All your data is in one place. But again, how do we govern your personal data so no one else gets access to that? So this data is one, of course, AI, and the thing we mentioned about not having to do sick care, instead pursue healthcare. So maybe wearables and AI just collecting data. And most of you, I know, are wearing watches that collect your data, and you don't ask where this data is being stored. One day, Google will tell you not to eat what you're about to eat.
Thank you very much.
Yeah, data. It's actually why everyone in the tech space wakes up in the morning. And I do agree, data protection act does insulate us who already started in the space. So that gives us a head start because then if you're coming from the outside, it limits you in doing whatever it is that you need to do. And I think for the key thing, again, just going back to who and why are you doing this, who are you targeting? You're trying some of the things might be taken up, some of the things might not be. And one of the things that we really experience is that tech is just a small component of what actually the solution is. It's a mobilizing individuals, like Dr. David here, who started this. Bringing everyone in this room, having these kinds of conversations is one step. Empowering people to actually do what they're good at. Is it you within the clinical setting? Is it within the advocacy space? That is something that you can focus on because the tech is built on that, right? When everyone is mobilized, connected, doing what they need to do, the tech flourishes. Case in point, look at the phone. So you can access that information to build that kind of capacity. So the sooner we get this done, the better.
Just give a scenario based on what you asked. Recently, I took my father-in-law to see a specialist. And so he asked us for some lab tests. So he asked, so do we go to any lab? He said, no. Some I don't trust. And I think that's what you're talking about. We need to celebrate those who do right. But you also need to punish those who don't. Because healthcare is not any business. Dr. Kibiriti talked about ethical practice. I think this is one of the things that you started by giving how medical errors are costly. I think there's this photo that used to circulate of some surgeons who left some of the equipment that were using in someone's abdomen. They closed up and they left there. When they went for imaging, something foreign was found. You can imagine what that meant. What you're looking at is, and I heard the current government, when they were campaigning, they talked about how to make a system one. They were comparing this to the NHS in the UK. How hospitals and all this data can be collected centrally. So that if you report the diagnostics to a central database by the government, and continuously will be reporting this. I know they have the HIS which collects data and parking. I wish they could expand this to collect lots of data so that people can analyze it from a central pool. If a facility is not a member of that, then there will be a consequence, even if it's private. But any facility that connects this central, it means we are open for audit, transparency, I think also it was meant. So every test we order, every prescription we do, all this data is stored, not only in our servers, but also in the government server. If anyone wants to audit us, then that will be transparent healthcare offering. And I think if those kind of things will be pushed, and I hope the government was serious when they meant this, some of these things will start here. So I had to be sent to a lab that is far away from the clinic that I went to, just because the consultant didn't trust the labs around. Whose cost is that?
Thank you for that. Maybe to just add, just like I've said, I do not think we'll be able to do much with respect to universal healthcare until we have an integrated health management system whereby if you're working at the dispensary, you are able to log in and see what is happening. And when you are referring, the person that you are referring to level 5 will just touch the button and see what was done to you. And therefore, it will be a continuity. When the last regime launched WIMSI, one of I think they were trying to do was to have a Huduma number. And around 50% of Kenyans registered that number. When I was checking, it's only 20% who collected their cards. And so therefore, we have the infrastructure, and when I program it, why people are not collecting their cards, there was some sort of mistrust, and there were some groups that went to court. Why? Because there was mistrust in terms of what are we going to do with my data. And then the court was asked, is there legal framework to take care of this data? So I think what we just need to do is to involve everybody, to explain to them what the government was planning to do with the Huduma number or the system, what measures are there to safeguard people's data, what the government or whoever is in custody of that data can do and cannot do, and from that we can be able to use that system to enable UNC. Thank you.
just also give an example. We, at some point, were asked to help digitize maternal neonatal audits. From the ministry, there are around, I think, 5 forms which have to be filled physically. Any day that happens, whether community or facility. And what we encountered was, technologically it was easy. To implement those forms, use mobile devices, it was easy. The hard part was to roll the wings of government, of course. And I keep wondering, if technology is around right now, I think CAK, Communication Authority, said over 70% of Kenya is covered by internet right now. What is healthcare sector doing to take advantage of this? If there's something else, a health center or a dispensary, they don't need to have complicated computer machines to key in data. But they have faults. Don't you walk into a dispensary and you find someone, that healthcare provider there on Facebook? Is in that data at their disposal? Can such things also go down to the place where care is offered? Walk to a chemist. Those guys, when they don't have patients, or watching YouTube, right? Can they use those same devices? And this is opportunities again for young people to innovate. Can we have things that they can use mobile devices, post that data to a common database where this audit can be done? Some of these areas are opportunities that we can take advantage of.
All right, thank you so much. Thank you so much for those contributions. I think what stands out there is we need to have a health system that is integrated and can allow collaboration among the healthcare workers, because I think that is some of the things that we lack, so that we can have an efficient health system. So, because of time, I'd like to just ask you to just give the parting shots. Meanwhile, as we wait, do you have any questions from the audience?
Maybe a contribution.
Hi there. My name is Kibiriti from Munyakin University. First of all, I must appreciate all of you for this conversation. It was very informative and it starts many areas that I hope to learn more from. And just to strengthen the need for integration, both, and sometimes you experience things like a patient is brought in from either from home and has been started on medication. And then 12 hours down the line, the doctor comes in, changes that kind of medication, starts their own. 24 hours or 48 down the line, perhaps it's not that doctor again doing it. Another one comes and starts again their own medication. Another case scenario is a patient has been treated at a level 2 hospital and has been referred maybe to a level 4 hospital. And the things that were done at a level 2 hospital or level 3 hospital, they come here, they are all repeated, irrespective of what was done at the baseline hospital, such that there is no continuity. Because at the level it will boil down to the patient carrying the cost of the first facility and now the second facility. Then the history. The history was taken from the patient at the first point of intervention. When the patient comes to the next level of hospital, the same history is being repeated, and another one comes against it, this the information, and it tends to sometimes annoy the patient. And that's why you can find that one patient gives 2 different histories. One of them is true, the other one is out of annoyance. They are annoying, you keep asking the same questions. Don't you doctors sit somewhere and just put this information together instead of coming to repeat this information over and over? So it all goes back to us. We need a system where we don't put the patient into so much strain. And we collect all this data together, and perhaps we have a server, so that the hospitals that are registered, they have registered medical providers can access this server for all the information that they need, and only go to add on or clarify what is not covered. I wish that this one should actually be extended, not just in public hospitals, because I've spoken about public hospitals. But then we need an integrated system that also brings in together the private facilities. There are private facilities that their information systems are well above. Like they have a way in which they connect all this data. And for groups of hospitals, they actually can share that information amongst themselves. If we could have a system where there's that integration between the private facilities and the public facilities, and we share all this data, the idea that we're using, sharing with the public, let us come together and run with the common patient for the common good. Thank you.
Thank you so much, Frederick, for that contribution. Maybe from the panel, anyone with a contribution on that?
Yeah, so let me apologize for my community that keeps asking questions. These time patients come to see us. But I do agree with that. And just to echo what you're saying, so I used to work in an ICU. And this is the power of digitizing and centralizing care. As we all know, ICUs are not holiday homes. Patients are coming out very sick. And because of the intensive level of care, which requires a multidisciplinary approach from different individuals within the healthcare sector. Now, the beauty of where I used to work, I won't mention the name, but everyone used to see a log of what happened to that patient from the moment they were admitted to the moment they were discharged or otherwise. And every single decision that was made was documented digitally. So that if somebody were to say that I didn't know what happened to this patient, that was something we never had of. Because everyone had a record of who saw the patient, when, how, what time, what was done. And to the point that when things were okay, we could anticipate when they wouldn't be. And outcomes actually improved. In an ICU setting, where again, it's not about people that are being very sick. And if that's the same thing that we could do in an ICU setting, you can imagine what can happen in an outpatient setting, where everyone comes in left, right, and center with the flu. But as we're seeing these guys with the flu, we can actually remotely see them, or we can take them to lower levels of care. We can build capacity for those individuals. So those that are really sick in an outpatient setting can get priority. It frees up a lot of resources for these centers that can't have that capacity to take care of the very sick. But it also allows patients who are not as sick to actually get care. And just echoing what you said, we shouldn't be selling sick care. It should be health care. It should be ensuring that our role as providers, in whatever shape or form, is making sure that patient stays healthier and longer. There is a lot of advantages. There's so many studies that have been showing that by doing just that, it touches in every single sector, from GDP per capita to revenues in whatever industry that you're talking about. It's really beneficial. So yes, we do need to start this as young people with your phone, just on TikTok. You can actually start programming on your phone. Literally, there are certain programs that you can do that for. You can build capacity for yourself. You can be the ones who build these products for us and for future generations. You have the tools and capacity to do so, so we should start now and not tomorrow.
Yeah, thank you so much for that. Maybe we could give our parting shots and also possible visit. I remember first it said that you should just mention about what you do as a, for example, diagnostic performance manager. Right, maybe start John. This we do is quite direct.
Thank you. What I do, actually, I found a problem. My business partner, as a doctor, was working very soon at another company. He had recently graduated, and the cases he found on ground, not was on ground and different, were not what he was used to in books. And rarely would he have someone to consult. And still, he had to meet his boy's application. As in fact, just married on that, what made us what we do. So the Daktari created a community of healthcare workers. They can consult, they can learn. And we're even now looking how they can even create their digital CV You don't have to keep doing it on LinkedIn. You can have a digital CV. You've done this surgery, you can log in. So we are recruiting something around the healthcare community. But insurance. Healthcare has many faces. You may be facing it from the pharmacy side, you may be facing it from a nurse, you may be facing it from the technology. But all of us have one goal, I think which you mentioned. Have a patient who is healthy for longer. If that's not your objective, even as you're thinking how to innovate using technology, if that's not your goal from your work goal, stop it. Just do other commercial apps or just do other things. Number two, healthcare is heavily regulated. Don't come in here with your ideas thinking all ideas will fly. There are regulators every sector, every way. So there are regulators. So just have yourself on that. And lastly, healthcare technology cannot work alone. Technology is one part. There are people to implement it. There are systems upon which to work on. You may have a good idea with a good tech skills, but you need not to work alone. Consult, work with other people. That's one way you can see the light of day. Finally, every solution has to be sustainable. I've seen many solutions that have come up, are well known, up and running, then after a few months or years, they are nowhere to be seen. When you're thinking of a solution, think of sustainability. Thank you.
Thank you. I think I'll start by telling what I do. So I do demand creation, social education, and simple terms. My work is just to collect insights from our problem targets and use the organic insights to design solutions that we use to influence behaviors of our targets in terms of technical products and services. So, simple. And my package short is that the next health professional, millionaire or billionaire, do not be a surgeon or other generic healthcare worker. They will be a digital health innovator, because that is the uncharted water, that is the gold mine. Thank you.
Thank you. So for me, so the title is doesn't really exist. But basically, BioNate, as I mentioned, is a telemedicine provider. We are trying to create a hybrid solution for empowering physical care with digitization. We have an application and patients can speak to doctors in time, and doctors can document that same thing in digital. And we are connecting labs, pharmacies, clinics, everyone together so that the patient can get services wherever they are. And my role is just to make sure that the people who are the providers are given the tools and capacity that is needed to ensure they can do their job well. But also on the dev side, I work on the application and some section is the symptom checkup, which patients use as a self-triage mechanism. So my job is to make that as accurate as possible. But as a parting shot, key thing is just echoing what everyone is saying. Yeah, yes, digital innovation is the next big gold mine. That's why everyone is getting into this space right now. And keeping patients healthier longer should be the goal and strategy, whatever you're thinking about, let that be your North Star. And lastly, health tech is built on people. So whatever you innovate around, the tech can be built. It's the people that you need to focus on. And if you focus on the people, the tech will flourish.
All right, thank you so much for those wonderful insights that you've given us. So this is where we end our session, and I'd like to ask everyone to give them a round of applause. Thank you so much for taking your time to come join us for this panel. I was the moderator for the session. Hezron, thank you.
The moderator has said that